Hello and welcome to I Got You, your go-to for honest, simple conversations about vision, eye health, and general wellness. I'm your host, Dr. Valarie Jerome, optometrist and total eye nerd. No jargon, no hype, just real talk, grounded in care and expertise. Because your eyes matter, and so do you. This is a space where you're going to feel heard, seen, and supported. And you're going to get some information that you can actually use. So don't worry, I got you. Hello and welcome back to the podcast where it's all things eyes. I'm Dr. Valarie Jerome, optometrist and complete eye nerd. And I'm really excited today to talk to you about something called myopia. Now, myopia is something that affects many people worldwide. And we're going to talk about some options to help slow down myopia and what myopia is. Whether you've been told that you have myopia or your child has myopia, this episode's for you today. I'm pleased to be joined today with my first guest on the podcast, Mr. Luke McRoy-Jones. Hi, Luke. Thanks for joining us.
Hi, Valarie. Thank you for having me. It's a pleasure to be here.
So, Luke, you are a fellow UK optometrist. You are also the current Regional Medical Science Liaison. That's a big title there for Luxottica, EssilorLuxottica here in the UK.
Yes, that's correct. So I'm, as you said, an optometrist by background, and my role is sort of professional relations, field-based, supporting eye care professionals across the south of the UK with education and particularly around myopia and myopia management.
Fantastic. Thanks, Luke. Thanks for joining us today.
Thank you for inviting me.
So Luke and I go way back. Well, probably the year was 2000...
It would have been pre-COVID, so
it was
2018,
pre-COVID, maybe
2019.
2018, yeah, 2019. Yeah. So Luke and I were both nominated for Association of Optometrists Awards. Luke was nominated for Student Optometrist of the Year. I was nominated for Locum Optometrist of the Year, and Luke won the award. So congratulations, Luke, on that award. I didn't, but I got a day out and a day away from the kids, so that was nice. I'd have a nice night out in London. So yeah, that's how Luke and I know each other.
Yeah, no, it was a great night and really sort of set a foundation. From there, obviously, we were on the AOP Council together, and obviously we've kept our relationship going forward.
Yeah, it was good. So we were on something called the Association of Optometrists Council. Now that's where we help to promote the profession in the UK and support other optometrists throughout the UK. And it was really good to work with you there. Yeah,
it was a pleasure. And it was a really interesting time, I think, during COVID as well. A lot of the work we did was supporting eye care professionals through the pandemic.
But today we're going to be talking about something really exciting, myopia. Now, yes. Myopia is just the fancy word for short-sightedness or nearsightedness. So the way I've always described myopia, Luke, to patients is it's a process where the eye just gets a little bit longer and longer and it stretches, and that's what changes the prescription. Now, also as the light comes into the eye, it doesn't focus in the right place, and that's why we need glasses to move that focal point into the correct place. So that's sort of the basics of myopia. How do you describe myopia to patients?
Yeah, essentially pretty much the same. So it's basically the eye becoming longer, and when the eye's becoming longer, the light is focusing in front of the retina. So we need to help focus the light onto the retina. So we use glasses, minus glasses, to help focus that light onto the retina so that we can see. But it's that, we call it as optometrists axial length. So it's the lengthening of the eye over time.
Yeah, and myopia is something that affects a lot of people. They predict in 2050 that 5 billion people will have myopia, with a fifth of that being people that suffer from severe visual problems or blindness or vision loss from myopia.
That's from the Brian Holden research, isn't it? So they looked at data from the 1990s to sort of the 2000s, and they used sort of the population estimates and data, and they found by 2050 about half the world's population, so as you said, about 5 billion people by that time, and obviously with increased levels of myopia, there's going to be increased levels of higher myopia, so as you said, potential increase in risk in visual impairment by 2050. So it's definitely a big public health concern and an issue going forward.
Yeah. Now, you might say, so my kid's short-sighted, so they have to wear glasses. What's the big deal? Well, one of the things I tell people, and I'll tell everybody on the podcast, is you cannot, as a parent, you would never believe that your kid will become 30, 40, 50, 60, 70, and as they get older and as they have changes to their body, you don't want the eyes to be in trouble. You want that child to have as good a vision at age 70 as they had at 7 years old. So what can we do about myopia, you ask, as a parent, as a listener? What do we do about myopia? How can we slow this down? How can we stop our kid from becoming more short-sighted and getting problems with the eyes? Well, there are several different ways that we can do that, and one is with glasses and contact lenses. One is with Ortho-K, the other's with atropine eye drops, and also, this is the big one, and sometimes we forget about it as optometrists and as parents, lifestyle habits. So there are some things that we can do to help either prevent short-sightedness from happening or slow it down, right, Luke?
Yes, no, definitely. I think, as you touched on there, that lifestyle advice really is that sort of first line of treatment. It's an important consideration. So the analogy I really like to use there is if a doctor has a diabetic patient, of course, with time, the doctor may prescribe some form of medication. They may put the patient on metformin, but that doctor will also say, eat a healthy and balanced diet, have some exercise. And with myopia management, it's the same. We know that time outdoors and there are lifestyle factors which feed into that myopia progression, and if we can advise that lifestyle advice to take breaks from screens, to have time outdoors, it really can help prevent the progression over time as well.
Yeah. So what are some of the problems, you might ask? Why should I be worrying about this eye getting longer, this eye stretching? Well, there are conditions that can cause. And we've got cataracts it can cause, glaucoma, myopic macular degeneration. What are some of the things that you talk to your patients about, Luke?
So yeah, as you've touched on, as well as the cosmetic sort of disadvantage is to being a higher myope, and there are a number of pathologies which have an increased risk when it comes to higher levels of myopia. So things that you've touched on, like myopic maculopathy, glaucoma, retinal detachments, and often when I'm talking to patients, I outline sort of increased risks of pathology, but also as well, as we've touched on, the cosmetic disadvantages, also in terms of career prospects. So certain roles, for example, like military roles, may have a limit, -6 cutoff or something like that. So obviously, if we can limit or slow down that myopia progression and sort of lower that endpoint, it does have more opportunities for that child as well going into their adult life.
Yeah, I like that you mentioned job opportunities, because that's something that will hit home to any parent. There's certain things that your kid wants to grow up and be. My husband actually wanted to grow up and be an RAF pilot, but because his grandfather was. But unfortunately, he was -650, and it kept growing a little bit, going and going and going. So he didn't get to be an RAF pilot. But he's a fantastic carpet fitter, I'll tell you that. He's fantastic, and he's good. He's good at what he does.
Good, yes.
So let's talk a little bit more about the choices in terms of spectacle lens options for managing myopia. Now, you might hear us use these words: myopia management, myopia control. These are all things that work to slow down the growth of that eye so the eye doesn't keep stretching and stretching and stretching. You're going from -3, -4, -5, -6. But it also is protecting the health of the eye in the long run, like we talked about, from getting those retinal issues. And one of those things could actually be retinal detachments. I have been very pleased with a product from EssilorLuxottica called Stellest. So I have been very fortunate that in this country, in the UK, we do have options in terms of myopia control lenses and also myopia control contact lenses. I know my colleagues in the States they were a bit lagging behind in terms of being able to offer everything to their patients. But here in the UK, I've been using myopia control lenses since 2019, and I have been really pleased with Essilor's product. Just to share some personal experience with patients of mine is I get a child that comes in and they come to me and they're a -1, and I can keep them a -1. I get parents that are really pleased when they buy that nice pair of lenses and they don't have to replace them the next year. and they know that their kid's not going to grow up and be -8 like they are, the parents are thrilled and they're so happy. So today I want to talk a little bit more about the product that the company EssilorLuxottica has called Stellest. So I get some questions from parents, and I'm glad that you're here with me today, because I'm going to ask you some of the questions that parents usually ask me, and we'll talk about that, because they might be questions that people who are listening have about these lenses. Because let's face it, glasses aren't cheap, and good spectacle lenses aren't cheap either. So if someone's going to invest in it, they want to know a little bit more about the product. So I've got some questions here, Luke, for you. I'm going to put you on the hot spot, all right?
I mean, just to sort of echo what you said there, as we said at the start, you know, I'm an optometrist by background. I've got a mix of experience both in the UK and also most recently out in Malta, where I was practicing for just under 2 years. And anecdotally, I had really good results with the Essilor Stellest product. So I had a number of patients on myopia management with this, and the results I was getting with children and parents, as you said, were thrilled. So I really do believe in the Stellest lens. And as I said, now I work with EssilorLuxottica in this position to support eye care professionals. But yes, I'd be delighted to answer any questions you have about the lens and how it works.
Good, Luke. Thank you. Here, I'm going to put you on the hot spot here. So some people will ask me this, patients will ask me, when did they start the research on myopia, in terms of like in general, but basically with Essilor, when did Essilor start doing their research for this?
Sure. So after we referenced some data there from the Brian Holden Institute, which is actually quite recent data, those projections that by 2050 half the world's population could be myopic. However, data and research collection started much earlier than that, and actually it's been ongoing for over 30 years. So Essilor originally started some research into myopia management even in the 1980s, and that was in progressive lenses and older spectacle lens forms, and so we have got a variety of data going back, said to the 1980s. So yeah, as you said, you know, I think we're very privileged now that we have accessible spectacle lenses like the Stellest lens, and often, you know, patients will say to me, is this new? And yes, it is fairly new in terms of the form we know it today. But as I've alluded to, there has been research and sort of methods ongoing for a number of years. Most recently with the Stellest lens, we started our 2-year research study in 2018 in China. That research study has been ongoing, and it's now been extended. We're now in our 7th year of data collection, so we release our results every year. But so 2018 was the original study that began. We recruited a group of children in the Stellest lens and a group of children wearing normal spectacle lenses, and they were monitored every 6 months. So they were we looked at their prescription, we looked at the length of their eye. So as you alluded to earlier, the main mechanism to how myopia is progressing is the eye is lengthening over time, so it's getting longer. So those were the outcomes of that research study that they were looking for. So that study began in 2018.
So it's not anything now. And I know it's been around for a while, because when I was in optometry school, one of my fellow classmates had a pair of glasses that had a bifocal to them. And I thought, why are you wearing bifocals? Like, we were just starting optometry school, so I didn't know anything about it. She said, well, I'm a minus 0.50, and I've been that since I was a young child. Her dad was an optometrist, so that is how he did it. Back in the 70s and 80s and 90s, that's how her dad, the optometrist, and her mom was an optometrist as well, or is an optometrist as well. That's how they were treating myopia, with the old flat top, the line bifocal that no kid wants to be seen wearing. It's like socially awkward to wear that. So these lenses are pretty good, and we'll talk about that, how they look in just a moment.
Yes, definitely.
So how long has Stellest been on the market? Some patients will ask me that, and some parents will say, well, how long has this lens been on the market?
So it was released in the UK in early 2022. As I said, our research study on the Stellest lens began in 2018. So after a couple of years, we'd start to have some data, but it was released in the UK market when we had that data, because, you know, at EssilorLuxottica, we have a long-term commitment to high quality research, and we get that as eye care professionals, optometrists, dispensing opticians, we want to be recommending evidence-based solutions to our patients. So it's been available now for around about 3 years in the UK market. And in those 3 years, we're continuing to innovate and update the product. So we have been updating the prescription range, for example, to make Stellest more accessible to a wider range of prescriptions. And we've also enhanced the product with things like tint options. So there's now 6 tint colors, and we'll continue to enhance and update the product going forward, and to give better availability and accessibility to the patients who need myopia management.
Great, great. Some parents will ask, like I was just mentioned, is this like a bifocal? Is this a varifocal or progressive? Like, how does this work? Is it like the glasses that I have to wear now that I'm 40? How does this Stellest lens work?
Absolutely not. So it doesn't cosmetically look any different to a normal spectacle lens. So there's nothing to worry about in terms of dividing lines. The cosmetics of the lens, if a child was wearing a Stellest lens, you wouldn't necessarily know that it was a myopia management solution unless you looked in close detail.
Yeah.
I actually have a lens here if you'd like to see it.
Let's take a look.
So this is the lens here. You can have a little look. So it's got some markings from our lab on there, but you might be able to see that, cosmetically, that will look like a normal single vision spectacle lens, so no different. And basically the way this works, so there's no dividing lines or anything like that, but we've got an optically clear zone in the middle. So that's where the child is looking. So when they're looking at the board in school, maybe they're watching TV, they're looking through that clear zone. So their vision is corrected and they're seeing well. And in the periphery of the lens, we've got rings of what we call lenslets. And these lenslets have different powers across the lens. And essentially what they're doing is creating defocus in front of the retina. And that defocus is helping slow down that signal to the brain that the eye needs to grow. So as we've touched on already, when myopia is progressing, the eye is lengthening. And we want to slow down that signal that the eye needs to grow and lengthen. So what these lenslets are doing, these invisible to the naked eye lenslets, they're creating defocus. So they're bringing the light in the eye forward and slowing down that signal. So there's no cosmetic disadvantage or aesthetic disadvantage to the child wearing them in terms of how they look or how the child would see in the lenses.
And they're not really any thicker than a normal lens either. Because some of the parents say, how will this look? Are they going to look like Coke bottle glasses?
No, of course not. So obviously the cosmetic finish will depend on the child's prescription. However, with the Essilor Stellest lens, they're made in a polycarbonate material. So this is a lightweight and durable material, perfect for children, active children, young children. And they also have the Essilor Crizell Kids coating on. So this is an anti-reflection coating to improve the cosmetics of the lens and to reduce reflections as well, and just keep them a little bit cleaner.
There's going to be no reflections on this. It's going to reduce nearly all the reflections. And that's the important thing to remember when you wear glasses, and this is just in general for everybody. If you've got a lens without an anti-reflective coating lens, the glare on the front and the back surface of the lens will always hinder what the spectacle lens is trying to do for the power of the eyes. I always explain it that way.
Yeah, no, definitely. I mean, as I say, cosmetically for both, looking at the lens and also the child looking through the lens, the coating on there really does help as well. And it's UV protected as well. So as we alluded to earlier, you were talking about that lifestyle advice. It's a known piece of lifestyle advice that we want to encourage children generally to be spending time outdoors. So the International Myopia Institute recommends 2 hours a day, generally outdoor time. And having that UV protection in the lens as well as a tinted version available really does allow you to encourage full-time wear of the lens and also some time outdoors as well.
Yeah, I always recommend that for any kid who has a short-sighted parents, because if you have one short-sighted parent or two short-sighted parents, it's even more chance of you becoming short-sighted. So it is genetic. But I always recommend to them, spend as much time outdoors as you can. A little bit hard to do here in the UK in the winter, but I recommend as much as 4 hours outdoors.
Yes.
I mean, I'm being real optimistic here, 4 hours outdoors. But I also say no more than 2.5 hours of close time, being screen time or up close time. Now, I know they do a lot in school, but I'm talking about after school or weekends. I always say that, and the kid is like, well, I can do that, but what about mom or dad? So we need to practice what we preach.
Yeah, and I think as an optometrist myself, I often get asked, in practice, parents saying to me, how many hours a day should they be spent on screens, and what should I be doing to help their eye health? And I always really do emphasize the importance of limiting screen time, having breaks from screens, having that time outdoors. As you said, unfortunately, here in the UK, it is a little bit more difficult to encourage that, particularly in the winter. When I was practicing out in Malta, where they have 300 days of sun a year, it was a little bit easier to encourage the outdoor time. But it really can make a difference, and it really is a good piece of lifestyle advice. And, going back to that analogy I made earlier with the sort of diabetic patient for a doctor, it really can be a first line of treatment as well.
So tell us about the findings from the research on the Stellest lens so far.
Sure. So I said anecdotally, and both of us have very good results with the Stellest lens. But at EssilorLuxottica, we really do have a long-term commitment to collecting clinical research data. And there are a number of myopia management solutions available in the UK market. And I would encourage any parent and any eye care professional to really be looking at the research behind it. So at Essilor, we began our original Stellest studies in 2018. We're now in our 7th year of data collection, and we've got studies ongoing in Asia and also in Europe. And we've just in the last few weeks released our 6-year data. So the 6-year data shows a sustained high efficacy. So it shows that the lens are working over a long period of time. In our original study, the 2-year study, we found a 67% efficacy in terms of the myopia progression when the children were wearing the lenses full time. So when they were wearing for 12 or more hours a day. And that was in terms of the myopia and its progression, and about 60% efficacy in terms of the eye elongation, the lengthening of the eye over time. And essentially, as we go longer into this study, so we're now in our 7th year of this study, it's been extended, the children becoming older. So in the original study, when we started in 2018, the children we had in China were aged between 8 and 13. Now we've got children aged between 14 and 19. So it really is allowing us that opportunity to see how it works over a sustained period and how it actually works in different age groups as well. But I said we've just literally in the last few weeks released our 6-year data, which is still proven and showing really high efficacy, really good sustained results. So as well as, anecdotally, and, when I talk to eye care professionals, excellent results. We do have our clinical research and data to back that up as well. We really do have a long-term commitment to collecting good, high-quality data, and where possible, we're using peer-reviewed data. And I said I would really encourage any parents to really look at the research and the sort of background to any myopia management solution that they may be looking into.
Yeah, that's really good information. It's good information for parents. One thing that parents will ask is, why is this lens more expensive than that basic lens? And I always explain it, well, it does more. It works two ways. It's correcting the vision, but it's also working to help control the length of the eye. That's how I've always explained it that way. But I think that the cost is a factor for some people. But but if you're not having to replace the lenses the next year, then
I think, as you say, as an optometrist from practice as well, I understand that cost may be a barrier to some parents. But as you say, there's a lot of technology that goes into the lens. So those lenslets, we call it the highly spherical lenslet target technology. It's taken years of innovations in terms of research and development to get this product working in the way it does. So we've got a long-term commitment to clinical research and data collection. So that really explains why the cost of the lens is a little bit more. But as you've said, potentially if it's working as it should, you're not maybe having to change lenses as often. So I think particularly in children's eye care, and there may be sort of a mentality or an expectation from parents that maybe their child's glasses, particularly if they're myopic, may need to be replaced every 6 to 12 months. But hopefully with Stellest as a medical intervention, as a treatment, we're helping to slow down that progression, and so reducing that need to replace the glasses as frequently. And at this point as well, it's just worth noting that Essilor do have a number of great guarantees to provide the parent with that extra sort of protection if they do decide to sort of start this treatment and invest in this lens.
Yeah, so tell us about that. If there's a change to the prescription, then they can get some sort of warranty or exchange on the lenses.
Yes. So basically, once they start with the Essilor Stellest lenses, yourself as an optometrist, as your local, eye care professional, you'll probably be following that patient up every 6 months maybe. If in that year from they've had the glasses, it's changed by 0.5 diopters or more, Essilor replace those lenses for the patient at no cost. So obviously, if it has changed, there is that protection that they get a new pair. There are also some guarantees if for whatever reason the child didn't get on or didn't like the lenses, we could also send them back and there'll be a refund in place. We don't have any issues of adaptation, so as well as looking at clinical research and how they work in terms of slowing the progression, we also look and monitor adaptation, so how children get on with the lenses, and our adaptation rate is 100% within a week. So we're not having any issues of adaptation. I haven't had any issues anecdotally, but there is that protection in place as well. And there also is a loss and breakage protection. So with children, sometimes we know that they do break or lose their glasses. There is that protection in place that if they're lost or broken, there's a fixed low price replacement set of lenses. So they're potentially not having to invest maybe, the retail price again of buying those lenses.
Yes, so that is one of the reasons that I use that lens. And another reason I use that lens is because kids adapt really well to it. I've used other brands before of the spectacle lenses to control myopia in patients, and they come in and, I'm just not getting on with them. I can't see the board. And it's hard to encourage that child to wear that lens if they're not adapting well to it. So speaking from my personal experience, I have tried other brands, and this is my brand of choice for my patients, and it's the only one that I'm using in clinic now because I'm getting such good success with it. I'm getting patients that have a stable prescription. It's not changing, and I know that I'm doing my best, and the parents are doing their best to protect the long-term health of that child's eyes.
Yeah, it was really pleasing to hear that. And I said, my personal experience from practice really does echo that. I spend the majority of time in my role talking to eye care professionals, so optometrists and dispensing opticians, and the feedback I'm getting from children wearing this lens is really good. As you said, adaptation, getting on with the lens is really crucial, because with all myopia management, it's based off the child wearing those glasses or whatever solution it is full time. So at Essilor, our recommended wearing time for Stellest is 12 hours a day. So it's really important that they're getting on with them, they look cosmetically good, they're seeing well, and as I said, it's really good to hear that your patients are adapting to them really easily.
Yeah, they're doing really well. So thanks so much for joining us today, Luke. And I just want our listeners to know that myopia is something that is manageable in most of the cases, and by managing myopia and help slowing it down, you're protecting the long-term health of your child's eyes. If they have any questions about EssilorLuxottica's Stellest lens, they can go visit the website.
Yes, we have a lot of public-facing information. So through the Essilor website, we reference all of our research on there. Lots of frequently asked questions, product information, but also do sort of consult your local eye care professional. So here in Newbury, Dr. Valarie Jerome, so very excellent community optometrist. So do feel free to direct questions to your local practice as well. So lots of information online.
Perfect. And again, like I said, I've always said this to patients, is that kid is going to grow up to be 30, 40, 50, 60, 70 years old. And you want your kid to have very healthy eyes, stable vision, both eyes. You want them to have it as long as they can. So if you have any questions about myopia management, you can feel free to check out my website. Feel free to book in with your local optometrist to learn more about this lens. And again, thank you, Luke, for joining us today. And if you like this podcast, if this information you found to be quite helpful, please share it with another parent or another family member. I would really appreciate it. And until next time, take care of yourself and take care of your eyes. Thank you so very much for listening to the I Got You podcast with myself, Dr. Valarie Jerome. Just a little reminder, everything that we chat about here on this podcast is for info and entertainment purposes only. So if something's a little blurry, itchy, or not quite right with your eyes, book in an eye exam with your eye care provider. Take care of yourself and take care of your eyes.